We are on day one of our info week for tennis elbow, and the reason that we've done the info week for tennis elbow is that we've just had a lot of clients coming through at the moment with tennis elbow. I'm just going to put my microphone just in case you guys need to hear better, so hopefully that might work better. But yeah, in terms of the difference of what tennis elbow is today, if you've signed up to receive emails, you would have had an email from me already today, and it's really about the external extensor origin of your elbow. So when you're looking at your elbow, you're looking at the outside bit here, so the lateral aspect, which is what we refer to as tennis elbow, and then the inside aspect here, which is what's referred to as golfer's elbow. So with the tennis elbow here, anything that will bring your arm up, so when you're using the extensors, typically the hand comes up or your fingers are coming up, and also if you're doing anything repetitive, because some of the the repetitive work actually requires you to work in that extended position because it's a functional position for you. We don't tend to work in that sort of position there, so it tends to be that repetitive movement. So when you're hammering, if you're turning a lot, if you're using keyboards, and then obviously typically with tennis, the arm's in that functional position this way, your extensors in that elbow here on the outside bit are at compromise. So that repeated movement means that all the muscles in the forearm here, as they come into that extensor origin and insert here, it pulls on the attachment. So it's really important that we work out, is it a problem where the muscle belly is affected? Is it a problem where the muscle as it turns into tendon is affected? Or is it a problem where it's actually on the attachment? And so obviously from our testing, tennis elbow is quite easy to diagnose. There's some pretty straightforward testing that we do to actually differentiate, is it a tennis elbow and does it test positive. The tricky bit gets how long you've had the tennis elbow for. Is it something that's been there just a few days? You know, you've done a whole lot of digging in the garden, you've been, you know, staying up late working on the computer, or you've been doing heaps and heaps of work, and is it just like a passing thing where you've just aggravated it, or is it long term? And when it gets to that long-term problem where you might have had it for a few weeks or it's coming up to months, that's when it's really hard to get better. So to start with for today, we're just basically talking about what is tennis elbow. So it refers to the attachments of your extensor muscles, so the muscles that lift the arm up as they join and attach into and onto the bone on the outside aspect of the arm here. It causes some tension. So you might hear it called lateral epicondylitis, and basically it's because it's the lateral epicondyle that it attaches onto, and that is where you get the epicondylitis, and the itis means it's an inflammatory process. So it's called tennis elbow, lateral epicondylitis. You might hear it referred to as tendinitis of the extensors. You might hear this referred to as your common extensor origin or common extensor tendon. And basically it all means the same thing. It's just different ways of making a reference to where your extensor muscles, or the muscles that lift the hand and the fingers up, attach at the bone, and their tendon obviously that they attach onto. So lateral epicondylitis, tennis elbow. Later on this week we're going to go through, obviously you've found out what it is today and where it is. We're going to go through how you get it, how it sort of can be aggravated, what it presents like, so what you're going to find it happen, what happens with it, what stretches are useful to do it, what your management of it should be, and what some strength work is. So the biggie with tennis elbow is most people go, ouch, it hurts, I'm not going to do anything, I'm going to rest it. And when you rest it, you do need to rest it in some cases. Obviously, if it's really acute, it's really aggravated, and it's a real tendinitis, you want to rest it and let it give it time to get over the inflammatory process. After that, it can turn into what we call a tendinosis, which is basically where the muscle and the tendon is becoming weaker because you're not using it. And in that case, we do need to move it and we do need to work it. And as you then start to use it, you might find it hurts, but hurts in a different way, or you might find that there's a limit on what you can do. So the management of it's really quite simple. It's just knowing when to do different things. In the acute stage, you want to rest it, you want to prevent it, you want to stop doing anything that hurts it. But as it progresses through its healing process, or as it progresses more along the track, you do need to be moving it, you do need to exercise it, you do need to stretch it, you do need to strengthen it, which might cause a little bit of problem. However, it's, that's when you're ideally liaising with your health provider, so somebody like us, to actually say, yes, that's fine. It is going to be a little bit sore, but you need to do this to get it stronger. Where obviously in the acute stages, things that you're doing that are sort of irritating it are things that you don't want to happen. You don't want to be getting it irritated because you don't want to make it worse. So hopefully throughout the course of the week, we should give you some info that might be useful to you. It's not meant to be a replacement for treatment, obviously. So that's my big caveat. It's not a replacement for treatment where, she said do this, I need to rest it because it hurts, or she said it hurts and I still need to move it. It's really a case of working out where you are at this present moment in time and making sure that what you're doing is the right thing. So welcome to Tennis Elbow Week. Hopefully you'll get something out of it. Always feel free. I'm going to be trying to go live. I think it's 1:10 here in Perth time at the moment, so we're in Australian Western time. I shall try and go live around 1:30 in the afternoon every day this week. So if you do have a question and you do have something that you would like to ask, feel free. Just type it into the comments, or you can email it to me, and I'll make sure I try and cover it in the next live. So today is all about what is it, where do you find it? So outside of the elbow, generally from repetitive movement, you've irritated it. It's sometimes it can be an acute issue as well, but we'll go through that more tomorrow. Completely opposite to your golfer's elbow. So tennis elbows on the outside, golfer's elbows on the inside. Initially in the stages it's repetitive use, and it can be that you've got some irritation there, so it's inflamed. Normally the management would be rest it, allow it to settle a little bit, then start using and stretching and managing it and strengthening it again. But like I say, tomorrow we'll go through some of the causes over the next couple of days, some of the causes, like what can cause it, but also what to look for, and also potentially how to test it in the next couple of days. So thanks for joining us. Hopefully if you are watching us live and you've got a question, I can answer it and interact with you. If not, don't worry, just email me. If you do want all this info in an email form, so you've got it on file to keep and you can just reference it through the email, then make sure you've actually signed up to receive all the info through our email list. So I'll try, if I can, just to tag it on the end in the comments under the live. If not, just have a quick hunt around and we'll see how we go. So thanks for watching, thanks for joining me this week if you've been signed up for them, and I'll see you later on tomorrow around 1:30 for our next section of our tennis elbow info. Take care.